Holly Blood here. I wrote my paper on Alaska Native homelessness within the state of Alaska. My essay explored how the westernization of Alaska Native communities has impacted current homelessness rates within Alaska Native populations. Alaska has some pretty dark history when it comes to Western influence on Alaska Native culture. So I'll be talking about that and how that influence has impacted Alaska Native homelessness. On top of the deadly diseases that were introduced to Alaska Native populations, there was also competition for land, food, and other resources. Educational assimilation of Alaska Natives was one of the most destructive aspects of Western influence on Native culture. Christian missionaries from around the United States began arriving in Alaska in the late 1800s, many of whom taught in village schools. In many instances throughout Alaska, missionaries and teachers prohibited the use of Native languages in missions and classrooms and punished, physically and emotionally, students who violated this policy. The effects of the abusive nature of these classroom environments have lasted through the generations, and often, modern day Western classrooms and rural Alaskan villages continue to conflict with Native cultural systems. Oscar Coagley writes that the modern public schools are not made to accommodate differences in worldviews, but to impose another culture, their own. This has had a confusing effect on the Native students. Alienation and identity crisis among the youth and their continual search for meaning are conditions of Native life today. Alaska Natives are essentially straddling two cultural worlds, that of their own traditional Native culture as well as Western culture. Oscar Coagley writes, little is left in natives' lives to remind them of their indigenous culture, nor is there recognition of their indigenous consciousness and its application to intelligence, ingenuity, creativity, and inventiveness in the making of their world. All of this cultural loss and deprivation has affected the way that Alaska Natives are now able to relate to the world. Historically, their ability to rely on the natural world around them was a sufficient means for survival. The freedom to live off the land has always been a culturally significant aspect to the Alaska Native culture. However, Alaska Natives now must compete with non-natives for subsistence rights to the land and waterways, as the state of Alaska and United States federal governments have established laws that give subsistence rights to all Alaskans regardless of need. Additionally, the ability to work for a living wage in rural communities is problematic, as there are often very few work opportunities within the villages themselves. This economic issue has led to an outmigration of Alaska Natives from rural villages to larger urban areas within Alaska, where higher paying job opportunities can be found, as well as more affordable housing and living options. One of the biggest influences on the outmigration of Alaska Natives from villages to urban areas was the construction of the Trans-Alaska Pipeline in the 1970s, a construction project that brought many high-paying jobs to Alaska for both Native and non-Native people. The influx of higher incomes brought with it continued issues regarding substance use and abuse. The introduction of alcohol and its misuse to Alaska Native communities originally occurred with the arrival of the Westerners in the 18th century, before which there had not been any documented problems associated with alcohol use within the Alaska Native communities. Since then, the relationship between Alaska Natives and alcohol consumption has become a rocky one. Indian Health Services reports that alcohol and substance abuse is the most significant health problem in American Indian communities, and few Indian families remain unaffected, either directly or indirectly, by alcohol abuse. Among Alaska Natives, there's a historical and generational trauma that underlies the risk for individuals to develop psychological problems that could eventually lead to alcohol misuse. Outmigration paired with inconsistently positive and negative economic influxes, the introduction of alcohol, as well as mental and emotional health issues associated with cultural identity loss, have all contributed to the issues surrounding instability of Alaska Native peoples across the state of Alaska. These issues have all had effects on Alaska Natives' ability to access and maintain stable housing in urban areas once they've moved out of the rural villages. For Alaska Native individuals who find themselves homeless after arriving in urban centers in Alaska, Alcohol dependence often becomes an issue for those individuals, a complex issue that has deep roots in Alaska's history. At the end of June 2016, 15.2% of Alaska's estimated total population were American Indian or Alaska Native. During the same months in 2016, from April to June, nearly 40% of the clients served in emergency homeless shelters throughout the state of Alaska were Alaska Native or American Indian. While many homeless people seek to utilize emergency shelter services, many homeless individuals and families do not. The estimate for actual Alaska Native homeless populations in the state of Alaska is unknown. An enormous complication with compiling data for homelessness rates in Alaska is that many small rural Alaskan communities do not provide services to homeless populations at all. In many instances, an individual may be homeless but is unable to access services that would identify that individual as such. Another one of the difficulties in tracking homelessness in Alaska is that many homeless people, particularly youth, are able to couch surf, a trend in Alaskan youth homelessness populations in which a young person will ask to sleep on a couch or a floor at a friend or family member's home. In Alaska, couch surfing is defined as homelessness because the individual is not stably housed. Stable housing is housing that is not at risk of being lost or taken away. Yet another difficulty in tracking homelessness populations in Alaska is that most shelters and organizations that provide services to homeless populations have protocols that restrict substance users from utilizing on-site services due to the unpredictable behavioral patterns of individuals who are under the influence of a substance. In Alaska, rates of homelessness and alcoholism are some of the highest per capita in the world. And while only about 15 to 20% of the general Alaska population is Alaskan Native, they constitute half of the clients in emergency homeless shelters. It is suggested that rather than a pathway to homelessness, alcohol misuse is a direct result of homelessness, used as a form of adaptation to cope with the stresses of living on the streets. The cultural trauma already being experienced by Alaska Natives exacerbates the stress that they experience as a result of homelessness. Providing resources for homeless individuals who are struggling with substance and alcohol dependence can be ineffectual without stable housing to prevent individuals from relapsing. Sobriety can be very difficult for a homeless person who is already struggling to have their basic needs met. The following is a statement given by the NCH in 2009. Breaking an addiction is difficult for anyone, especially for substance abusers who are homeless. To begin with, motivation to stop using substances may be poor. For many homeless people, survival is more important than personal growth and development, and finding food and shelter take a higher priority than drug counseling. Many homeless people have also become estranged from their families and friends. Without a social support network, recovering from a substance addiction is very difficult. Even if they do break their addictions, homeless people may have difficulty remaining sober while living on the streets where substances are so widely used. Homelessness prevention programs and substance abuse prevention programs that may be effective in many non-Native communities around the U.S. are not often effective for Alaska Natives or American Indians. Western health systems that are directed toward mental health issues, homelessness intervention and prevention programs, and substance abuse prevention programs do not make cultural sense for Native populations that need health and human service interventions. The unique issues and historical traumas experienced by homeless Alaska Native people mean that prevention programs need to accommodate their specific needs. Health service programs must seek to take steps towards developing culturally sensitive treatment and prevention programs that accommodate the needs that are specific to Alaska Natives who struggle to find their way out of homelessness, substance abuse, and mental health issues that are impacted by both. An unfortunate reality to the ineffective social and health service systems is that the Western way of treating Alaska Natives within the healthcare system is already deeply underfunded. Despite the fact that mental health has been identified as the number one health problem confronting American Indian and Alaska Native communities today, the lack of funding makes it an especially troublesome complication for Alaska Native people who find themselves in a homeless situation. What has been found to be most effective and resonant for Alaska Natives in prevention against homelessness, substance abuse, and mental health problems is not only support from the community, but also an approach to healing from the perspective of the traditional Alaska Native mindset, which is holistic in nature and seeks to give back a sense of belonging and wholeness to the Alaska Native people who have suffered so much loss and trauma.